Well, this is the Mass or Saline County COVID-19 update for March 16th. Next slide, please. Looking nationally, the numbers still continue to decrease, even from the last few reports. U.S. cases are down again, so are U.S. deaths. Next slide. And that same trend is continuing in the overall number of cases, hospitalizations, and statewide deaths, which are all good things to see that are happening right now. Next slide. As we look at what's happening in the county, here are our current reported numbers as of yesterday. One thing I want to bring note to is that in the last 2 weeks, we have only had 66 new cases in the last 2 weeks, which is a huge improvement to look at when even just 2 to 3 months ago, that might have been a single daily count of new cases. And thankfully, we've only had 1 new death in the last 2 weeks as well. The hospital is still holding at about 2 to 3 patients at a time that are COVID. At our 2-week percent positive rate has dropped significantly to 2.81%, and our 2-week incidence rate is down extremely at 79 per 100,000, which all of this puts us in a very good position right now. Next slide, please. So looking at the cases per month, you can see for the month of March, and we're about halfway through that, we've had 80 new cases for the whole month, which is a significant improvement over February. And at this point with a daily rate, this is more reflective of what we were seeing back in August and September. Next slide. And again, just looking at the comparison of deaths per month, again, just seeing that continued decrease from the heights in December. Next slide. Some additional updates. Testing is still available at the Church of the Cross, although utilization of that site has significantly reduced, but it is still available. End date on that is still to be determined, and some of that will depend on the funding and some of the legislation potentially that Michelle mentioned earlier. Next slide. A significant amount of things happening around vaccinations. By the end of this week, we expect to have vaccinated 11,000 or more people that live and work in the county, and that'll be about 25% of the adult population. Right now, we're still working on finishing up those phase 2 priorities. And based off the governor's announcement yesterday of phase 3 and phase 4 jointly beginning on March 22nd, we will are starting registration for those phases. Again, there's the website that people can go to register at. The Johnson & Johnson, of course, has been approved. We did receive 500 doses of that. Our primary focus of that has been trying to reach homebound individuals, homeless, those that are hard to reach, those that are congregate settings. And that has taken a significant amount of planning to be able to accomplish that at this point with our partners. But I think we're on a pretty good track to be able to have all of that used up, and then just have Johnson & Johnson and Moderna primarily as our vaccines available here in the county as time goes on. Next slide. Again, if you are trying to find out what's happening, these are still all of the multiple resources, radio, social media, the FAQ Friday videos, signing up for our Vax, Facts, and press releases, and also our saline.org coronavirus page. Excuse me. Next slide. Another update that people should be interested in. Recently, there's been an update made to the amount of time after being fully vaccinated or having the virus where you don't have to quarantine. And so now, if you are within that 6 months after finishing your vaccine series or 6 months from having the disease and you are exposed and asymptomatic, then you won't have to quarantine, which is another incentive to get vaccinated if you have not or were not planning to and you haven't had the disease yet. That will significantly help you in the long run. Next slide. So when I say fully vaccinated, let me make sure that that's clear, that fully vaccinated means 2 weeks after your second dose of either the Pfizer or the Moderna, or 2 weeks after your single dose of Johnson & Johnson. That 2 weeks is necessary for your body to have mounted the appropriate immune response and be considered fully vaccinated. CDC also and KDHE have adopted some changes that more affect gatherings in private homes, but basically if both parties have been fully vaccinated, they can gather in small groups in private homes without masks or social distancing. This guidance also says that gathering with unvaccinated people from a single household is okay as long as they are at low risk for developing severe disease, but still just continue to, that does not give a permission for a free-for-all or just to take masks off if you're vaccinated. It's still important while we are trying to reach specific levels that people still maintain distance, wear their mask, avoid crowds, wash hands, stay home when ill, and those types of measures. Next slide. Another update, KDHE recently added New Jersey or New York, as well as the countries that are listed on here to the travel quarantine updates. So if you traveled on or after March 12th to New York or New Jersey, you will have to quarantine upon your return. The same thing if you should happen to go to Estonia or Palestine, or if you went after February 26th to those countries that are listed on here. Next slide. So we continue to watch and monitor what's happening with the variants. I have placed a screenshot from KDHE's website of the current situation as of yesterday compared to the last one. And those numbers of cases attributed to the specific variants have continued to go up. Kansas is seeing some more cases. We have not seen any cases here in Saline County at this point, but this is just a situation that we continue to watch and to monitor. And we hope that as we continue to vaccinate at the rate that we are, that we can stay ahead of the development of any variants here in the county. Next slide. So this is what everybody wants to know. I still recommend for the time being that we continue the mask order. We have talked with our partners and have come up with some recommendations about when to consider either loosening or removing the mask order. One of those is a target of 70% of the adult population vaccinated. Understanding that normally herd immunity is determined around 70 to 80%. However, that percentage has not been fully determined for COVID. And this is just a target. This is not a hard number that we absolutely have to reach. We would just like to get close to that 70%, which would be about 28 to 29,000 adults in the county. One of the other things as a recommendation is to see multiple days without new cases. And we also understand that there may come a time where the overall vaccine demand is satisfied, and then that may also spur conversations too of what do we do next. And with that, that ends my update in regards to the mask order, and I will take any questions.
Okay. Are there any questions or comments from the commissioners? No? Is there any public that would like to speak at this time?
Commissioners, my name is Denise Ward. I live here in Saline. I just want to talk about the mask mandate for a moment, not because I think that we need to stop wearing masks. What I am here concerned about is the limitations that it's still putting on restaurants and bars. The social distancing guideline that is placed on bars and restaurants says that we have to keep our tables 6 feet apart. By doing that, even if the health order expires, the mask order actually still limits our capacity. It doesn't really put limits on gatherings, but by making us space our guests out so far, it keeps us at almost 25% capacity. I mean, you're still hurting all of our businesses, you're hurting all of our employees. I think he's going to, I heard at the city commission meeting last night that he was going to recommend that the health order expire. I urge you to please let that. Please quit putting limits. I mean, closing at midnight, we have employees who are losing entire shifts. I mean, that's an entire day of wages that they're losing because we're having to close 2 hours early. And that's all I have. Thank you.
Okay, thank you. Any other comments? Okay.
Dennis Benoit. I live in Geneseo, but I consider Salina my hometown. And I'm here again to talk about the mask. Is it scientific that by wearing a mask you are breeding your own bacteria? Is that an issue? And that the people, the doctors, talking about, I'm a healthy person, I'm on a zinc regimen, I'm a healthy person, I don't need to cover my face. A mask should be done by somebody that is sick or elderly person. I have several strikes against me, but I have no fear of the virus. And I had one other issue about how you count the infection rate. Can I talk about that right now?
We'll have a couple minutes here.
Oh, okay. I know you follow the CDC guidelines for infections.
Sir, could you
and most of their guidelines. Is that correct?
Sir, could you speak into the microphone?
I want to, 14th of April of last year, the CDC and the NIH had a meeting. They changed the definition of case. Due to the trackers, the change meant one confirmed, and that goes to the tally. Well, after that change that was agreed upon by the CDC, I want to know, are we following the CDC guidelines? That one case is now, with the trackers, they have to have their information counted. They're going to have on an average, just an average, 16 probable cases of virus infection. Is that added to the confirmed case, and is that number 16 and 1, 17, is that what goes to the infection rate for the grand tally?
And let me ask you, I do not know that. Jason, can you answer that, please?
Yes, I can. No, we count positive cases, which means there is a positive result. Early on, when testing was not readily available, there were a few cases that if they met specific criteria, meaning that they were in direct contact with someone who was positive, and that they developed all of the symptoms and likely lived in the household, that they may have been counted as a probable, but those were very small in number. Since summertime, I believe, when testing was more readily available in healthcare settings, every case that we have counted since then has been a lab confirmed positive case.
Thank you, Jason.
Okay, well, I also have a
And your
problem.
time's up now.
Okay.
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 Thank you, sir. Thank you. Good question. Any other comments? Okay.
Rosemary Meyer from Salina, Kansas.
Good morning.
I was kind of wanting to know why our surrounding communities have dropped all of their mandates. They've gone back to regular living. Our state capital allows you to be in there with or without a mask. They leave that up to the individual, whether they want to wear a mask or not. Why is it that we still are on all of these mandates? We are grown people, and I think we should be able to make our own decisions, and same way with the businesses, whether they want to abide by these mandates or not.
Okay. Jason?
In relation to other counties around us, they have looked at their own specific data, which that's the problem when you start comparing counties to counties, because each county is different. Each county has a unique situation when you're comparing their data. And I don't know that all of their recommendations, and I'm trying not to speak out of turn, but I don't know if all of their recommendations to drop things were always in concert with what their health officer was recommending. I don't have the specifics for each of those counties around us, but that is my best estimate at this point.
Okay. Thank you. Any other comments?
My name is Marie Scholastico, and I moved here about a year ago. I grew up here. And I think if people want to wear a mask, that's great. You know, but I just wish we had a choice, because I, take care of myself, and, I'm a hairdresser, so I know all the sanitation. I'm driving to other counties to do business because I'm tired of the mask mandate. I just want us to have a choice. And I own my own business for 17 years. And, so I know the responsibility of what some of these businesses are going through here. And it's hard, and I don't want to drive to other cities to do business, but that's kind of what I've been doing to, get around it. And I'm respectful. I wear a mask, and if someone asks me to leave, or if I didn't have it on when I walked in the door, I leave. I don't make any complications, but that's kind of what I'm doing. And it doesn't really, I'm getting frustrated because, I moved here, I grew up here, and it's making me second guess it, because I don't know that I want to live under these conditions, and there are other places that have options. And I'm a good citizen. I just paid my property taxes yesterday early. So that's all I have to say about it. Okay. But I just thought it'd be interesting to have a perspective from someone who, lived here and moved and then came back.
You bet.
So thank you.
Okay, thank you. Good morning.
Carol Woody, Saline, Kansas. We're all dealing with the mask, and I would love for it to be a choice. But we also have to keep in mind, while we're talking about all this virus, the people that are staying in homes because of depression, and the children, same thing. I have friends that won't leave their house because they're so afraid. I really, really think we need to move on let businesses open, get things back to normal. This waiting and waiting and waiting, it's been over a year. Please, just give it a try to get back to normal. And that way businesses can move on and quit losing money and quit losing business and closing down. That's all I'm asking. At least consider it. Don't just go by. Do we have to get to zero before we can move on some of these statistics? I don't know. Thank you for listening.
Okay. Yes. Okay. Yeah, there's a lot of different avenues and different directions, and all I can say is that Mr. Tiller, I think, has done a fabulous job in the whole health department and the Saline Health facility, putting that on at a JCPenney. I just been there, done it, and the vaccination is working well. I know people also that have been out there that I get phone calls from the guy about every month and a half going, Roger, when's this vaccination? Because it wasn't about the mask thing. It's about when is the vaccination going to get here, but where I can go out. And to me, when somebody says, okay, like yourself just mentioned, it started a year, or it's been going on, this just pretty much started a year ago. So we had to go through some areas of understanding of what this virus is, how it was going to affect people, what was going to happen before the vaccinations got started. And I look at it as that's kind of a rush deal. I look at it, this has been going on a long time. I look at the whole United States as going, I look at the world. This has devastated the whole world, not just Saline County or Salina, Kansas. This has devastated the world. All I can see is that I hope that the surrounding counties, I pray that everything works out great for them. I look at Saline County, when Jason was just talking about his next presentation on the public health order is next. So I look at some things and we don't know where it's going. So just give it a little time and we will get there. So that's.
Can I say one more
Yeah,
thing?
one more thing, yes.
I'm sorry. I want to say one more thing. Do you not think that and I'm not against masks for those who want to wear them. I
Yes,
think it's
yes.
a wonderful choice. But that's what I mean. It's a wonderful choice.
Yes.
It should be.
Yes.
I don't understand how touching your face 50 times, and especially children, taking them on and off and sharing them with a friend, that's why I'm wondering, is the mask really that good of a thing? I've seen documentaries, I've listened to, I've read
we all
things
have,
that
yes.
I don't understand that part being so important.
Yep, okay. Thank you. Any other comments from commissioners?
Mr. Chairman, we do have a hand raised.
Okay.
Renee Meyer,
Okay.
please unmute.
Yes, I'm concerned about the comments. I really think that we need to listen to science. Yes, business is important, money is important, jobs are important. I've been there, done that. I'm not working now, partly because of COVID. Ultimately, though, if we don't have our health, what else matters? So I really am supporting Jason Tiller's recommendations. And yes, it is hard. It's not easy. But hang in. We don't know about the new variants. And we're lucky we haven't had that at this point, and hopefully won't. But we don't know. So I think it takes a lot of patience and maturity to hang in and do what science tells us is the best choice. Thank you.
Okay, Lene? Okay. Next item?
Mr. Chairman, we do have one more hand raised.
Oh, excuse me. Thank you, Brad.
Unmute.
Hi, I think it's for me, right? Okay. So I have to go against what she just said. The county needs to get back to where we were. We need to get people out of our house. We need to get back to seeing and developing our people in our county. There's no reason why people who don't want to be out of their house can't stay there. If the majority of the people don't want to wear a mask and come out of their house, that's the majority of the people. We need to listen to the people. If you don't want to come out and you don't feel safe, stay home. But if you do, let's get out. Let's get back to normal. What's wrong with being normal again? That's my piece.
Okay. Thank you. Okay. Anything else? Next item.
Item number 3, public health order with Jason Tiller, Health Department Director.
Hello, Jason again.
Had to make sure I unmuted. So as I have mentioned, we looked at all the data. I just went over all of that. The current order is set to expire at 11:59 p.m. on March 21st. And my opinion is that with the continuing to decrease numbers, also that we did not see any kind of increases after raising those limits and capacities 3 weeks ago. With the deaths lower, the hospitalizations lower. I think at this point, the best thing is to let the public health order expire at that time. Now, one other thing I want to say is we're talking about these. Keep in mind that the public health order, the mask requirements that the city and the county both have in place, all of these are multiple layers that try to close up holes as far as responding to the virus and responding to the impacts of the virus, which is why I am comfortable with letting the mass gathering order expire at this point because we use data to drive its implementation, and I think data is also driving its expiration. But on the same token, to drop everything at one time, I think would be a mistake. If we let the order expire, we continue to vaccinate people, and as you have seen, more people will be eligible next week. So we'll be able to continue to vaccinate more people, and it'll just put us in a better position that when, without the mass gathering order, and then when the county commission decides to take some sort of action on the mask order, we will be in a much better position to not see any type of undue consequence from throwing the gates open all at one time. That's my comments on the mass gathering public health order at this point.
Jason, this is Commissioner Vidrickson.
Yes, sir.
I want to be clear on this, that the mask mandate and the health order are two separate situations. In other words, if the public health order is set to expire, that does not mean that we're out of the mask mandate portion of that. I mean, it's not a portion of the mandate. Is that correct?
That is correct. The mask mandate and the public health order are two completely separate items.
There are more items, though, to the public health mandate than just a mask mandate. I mean, does that affect the closing times of the bars, as an example?
Yes, sir.
So they would be able, on March the 21st, they would be able to go back to their normal hours. Is that correct?
On the 22nd, they
Or
would.
the 22nd, that's what I'm, yeah, at 11:59. Okay,
Yes.
that clears that for me.
Commissioner Weiss here, Jason. As far as the mass gathering, businesses would be allowed to go back to 100% occupancy at that time also? Or is there still the 6 foot with the mask mandate?
So the 6 foot would become a recommendation. And we are working on stronger messaging to ensure that that recommendation is still well known. One thing to consider too, even before this, especially when we're talking about events and event organizers and such, they routinely reached out to us even before the mass gathering order was in place to discuss what actions that they needed to take in order to try and ensure that their event was conducted, not only in relation to any type of rules or regulations that were in place, but also in conjunction with whatever the best practices were. And I expect that relationship to continue as we move forward.
I don't know if I'm clear on that, Jason. That was very eloquently said, but you're gonna have to dummy it down for me here. Will the 6 foot be a recommendation, or is it tied to the mask mandate, or is it tied to the mass gathering?
So within the mask mandate, the only thing it says in the mask mandate, and give me just a second, I had it pulled back up here, is there is a section that talks about people who are seated at a restaurant or establishment that offers food or beverage service can remove their mask provided they maintain a 6 foot distance between individuals that are seated together with only infrequent or incidental moments of closure. Athletes can do that as part of as long as they're a 6 foot distance. So there is still some distancing in the mask mandate in order to have those exemptions for removing the mask. More so in the mass gathering order was the requirements for reduced or a cap on capacity of a facility.
Thank you.
Any other commissioners?
Well, before we leave, Mr. Tiller, and I'm gonna relate this as my thoughts and my thoughts only. It's not reflective of anyone who sits up here as a commissioner. This is what I think as a commissioner. It's what I think as a citizen. And let me assure you, I respect every single one of you out there with your opinions and the varying parts of your opinions. Mine happen to be somewhat different, as it would be with Democrat, Republican, you name it. Mine are a little different than some of you, and agree with some of you. I certainly want to get things back going the same. What I want to do, though, I want to support Jason Tiller. He's had 12, and his staff at the health department have had 12 months of bashing. They've been exposed to all sorts of insults and so forth, and it's not their situation. He doesn't sit over there on 7th Street and make a decision on Tuesday morning that we're going to wear masks or that we're going to have a health order. He's in constant contact with the CDC, the KDHE, Saline Region. He collaborates almost daily with Saline Regional Health Center, with the Saline Family Physicians, Family Health Care, on what to do, what is best for Saline County and Salina. He is doing his very best, and I, for one, really want to thank him and his entire staff, along with the staffs of Salina Regional and Salina Family Physicians, Dr. Robert Kraft, Dr. Rob Freelove. They've done a marvelous job in face of all of this, and we're now, getting the results. We're getting down there where we need to be. And I've heard a lot of comments about we need to have a doctor in this position, not just Jason Tiller. Well, I would like you to come forward with me in the name of a physician who wants to go to work at Salina as the health director and take that $500,000 a year cut in pay or whatever it is that it would take to fill that position. Most counties in Kansas, you may not be aware of it, their health director is called the county commission. I don't think you want to, no offense to my fellow commissioners, but I don't want them to be my health director, I can tell you that, and you don't want me either. So I support Jason Tiller. I support the Saline County Health Department and everything that's going on with them. When I ran 4 years ago, I said I was going to follow the direction of the health department, and I'm still going to do that. And previous commissioners didn't follow that, and there was turmoil to no end. So I'm hopefully, I'm glad to hear him say that March 21st is going to be a target date. March 22nd, I should say, is going to be a target date. And let's all keep our fingers crossed that that's going to happen. And from there, I think the mask mandate will take care of itself. So thank you, Jason.
Jason, I'd also like to say thank you for your work the numbers that we're having, we're not, our cases are lowered, things are looking better, and that's not in spite of the mask mandate or the health directive, but it's because of that. It's because of the step up of vaccinations. It's because of everything that we're doing to get this county and this city open back up, to get back to that normal living that we all want, every one of us. And I'm happy to hear his recommendation on the health order. I applaud him, but I think we still need to be diligent. We still need to get shots into arms. We need to protect ourselves while this is happening. And that light at the end of the tunnel is getting larger and brighter every day.
And I'll agree with a lot of it. Is like one of the other things is that I just want to say is that I think a lot of the things that's happening, the numbers going down is because of Jason Tiller and this stuff. But realistically, we all know it's because of you, the citizens, because without wearing the mask, I feel that it's like with you guys not doing what you've been, let's say you've been asked to do, I think the majority of people have really done a great job following the guidelines and issues that's been put forth of you. I just want to say, I think that is what one of the major causes is, or the reasons why we're going down to help with the thing. So I just applaud all of the citizens of the county, the city, really everyone around the area that is, every time they come to Salina to shop, do something, I think almost everyone has done a great job of walking into the store with their mask on, following the guidelines of keeping the mask on, and everything has done. So whether that is the whole thing or not, but that's just another one of my thoughts. But I just want to thank you all for doing that.